All right. Good afternoon, everybody. On behalf of Azalea and the marketing team, we would like to welcome everybody to this month's Azalea Health Industry webinar. I will begin by apologizing. I am Allie, and I sound like sandpaper today, but I will do my best to stick this out with you guys, and thank you ahead of time for your patience. For the next hour, we'll spend some time addressing some of the most common questions, misconceptions, and user experiences with regard to telemedicine and its ability to impact business operations and patient experience in your practice. And before we dive into the heavy content, just a couple housekeeping details we wanted to cover. The webinar today will be recorded, and that recording, as well as the presentation and any handouts, will be emailed to all attendees later this week, as well as made available on our website. And please also know that we will reserve about 10 to 15 minutes at the end of the webinar to answer any questions that you guys may have, and you are welcome to submit your questions at any time through the presentation using the questions section in your webinar panel. These are the handouts for today's presentation, obviously the slides, as well as a number of info and resource reimbursement guides. Again, they'll be made available to you following the presentation as well as on our website. Our panelists today, we are so thrilled to have not one, but two really fabulous speakers for today's session. We have Mr. Greg Swain, currently a partner at TechCXO, and also a really trusted advisor to the Azalea team. Greg is the former COO of telehealth provider MD Live, which reaches over 30 million members with their MD Live benefit. And he is also the co-founder and president of ADAM, A-D-A-M, the Animated Dissection of Anatomy for Medicine, which has installations in over 90 countries worldwide. We also have with us Dr. Rashid Haq, who is a board-certified practicing dermatologist in Mint Hill, North Carolina, just outside of Charlotte, and also the Chief Medical Officer at Vigilius Telehealth. Vigilius is a multi-specialty medical practice providing care to rural areas with innovative and really cost-effective telemedicine technology. They are both a client and a partner of Azalea Health, and Dr. Haq will speak later on his personal experience as a telehealth user. Before we go ahead and jump into the presentation, I wanted to get started with a quick poll to allow Greg and Dr. Haq to get a feel for today's audience and everybody's current exposure level to telemedicine. So we're going to go ahead and launch our first poll. Is your practice or facility currently utilizing a telehealth solution? If you could please select one of the following, yes or no. We'll leave this run for about 60 seconds before closing. Okay, we'll go ahead and close that poll and share those results. So we are at an even split between 50% currently utilizing a telehealth solution and 50% not. Greg, Dr. Haq, for you guys, does that seem like a pretty standard split for the audience?
I would say,
Greg, yes. I'm sorry. Let me jump in first. I mean, if this had been a year or 2 years ago, I would have expected that to be much lower, but it's actually encouraging for me to see that it's actually at 50-50 at this point.
Yeah, I definitely agree. This is Rashid Haq. I definitely agree, and I think there may be a little bit of a sample bias as well with folks that are really interested in telehealth being represented here, but this is definitely the trend.
Good, good. Okay. Well then, without further ado, I will go ahead and I will turn the presentation over to our first panelist, Greg Swain. Greg, it is all yours.
Thank you, Allie, and I want to thank Azalea Health for inviting me to be a panelist today. And before I dive in, just a little more color commentary. I've been in the e-health space, I guess you could say, since the beginning of e-health back in the early 90s. I created a product called Atom, which originally was a dissectable male and female on the computer, and was in the right place, I suppose, at the right time with the right idea. But Atom ended up becoming a standard for medical education. It's in over 90 countries today, and we also morphed into the company that powered WebMD. So I was part of the WebMD team that developed the very first version of WebMD. All that is to say that I have been part of and seen firsthand a couple revolutions in consumer-driven healthcare, and I chose to be part of telehealth because I believe that telehealth ultimately is going to improve the efficiencies of delivery of healthcare. It's going to have a major impact on improving healthcare delivery. So I'm excited to be part of it. I actually was the COO of Florida-based MD Live for 3 years. And so I have a very specific experience with telehealth that I'm now helping companies like Azalea Health that to me are bringing telehealth actually to the real market, which is the providers that are starting to realize that they can adopt this on their desktop. So happy to be here. Sorry for the long intro. So what is telehealth? I'll let you all read the HRSA definition. Obviously, in short, it's just the ability to remotely diagnose and treat your patients using some form of telecommunication device. The applications are very different depending upon the practice, the size, and certainly in the last 3 or 4 years, the technology has evolved significantly. I think it really began as a store and forward model. You know, today it's much more of a real-time video conferencing model. And what's nice to see is that these technologies are embedded now inside of the workflow of your EHR. So to me, that was a major improvement in the implementation, because user workflow is all the difference in the world to actually using this in your practice. Next slide. So I know there are skeptics that are probably on the call, and you're not alone. I want to cite an article that I think is a really good one that I'm going to borrow from on today's call. But if you have a chance to review the link, I encourage you to do so after the call. But I'm going to go ahead and cover a little bit of some of the myths and misnomers. You know, the first one is that telehealth is for urgent care only. I mean, that is a true statement. Telehealth really started with urgent care being the first and largest use case. In the technology world, we would call that the killer app that drove the utilization of telehealth into a lot of practices. It was also, though, embraced by what I will call the disruptors of provider services like MD Live, which I work for, Teladoc, and American Well. These are companies that basically built a service in the cloud and essentially provide a disruption, if you will, of the traditional providers providing telehealth. Urgent care, though, is a very low ROI. It's a high volume, low price product, but it is the product that I would say has driven telehealth capabilities into more and more practices, and we're going to talk a little bit about the practices themselves and other ways you can build on top of urgent care. So from my perspective, you know, urgent care was and is important because it really drove the technology into the practices, and I think over time what we'll see is that on top of that we'll start to build much more high value services. So think of it as the first wave that drove telehealth into a lot of practices in the country, and you're probably evaluating that at this point yourself. The next myth is that you can't conduct a thorough exam with telehealth. And this is actually a moving target question. If, again, you had asked that question or you had that concern 2 years ago, I think it would have been more valid than it is today. What I would say about this is that the smartphone technology is continuing to evolve, and it's very, very revolutionary in terms of providing portability to the patient and providing a device in the home that I think we can all look forward to evolving to becoming smarter and smarter. So even though today you're limited to audio and video for the most part, I think that the basic belief is that over the next couple of years we expect this issue of surveillance to improve, and that there will be extensions to the smartphone that will actually allow us to start surveilling vitals like blood pressure, temperature, weight, and potentially even other vitals. So I think over time this will become less and less of a reason not to embrace telehealth. And if I were a provider today, I would want to be early rather than late in terms of adopting based on where the technology companies are driving this. The next myth is it's best to wait until telehealth is reimbursable. You know, this is, again, another thing that is evolving very quickly. Most of the states in the U.S. are now evolving legislation that will make this less and less frictionless. This is more of a vestige of the brick and mortar system, less about the technology itself. So I think over time we can look forward to seeing more and more reimbursements. So I think the bigger question, if I were a listener today, is, you know, can you really afford to wait? Because, you know, ask yourself, what is the risk of not adopting telehealth, especially if it is a consumer-led initiative, which it is. Again, I was part of the consumer explosion in the late 90s and early 2000s that drove a lot of consumers to the internet to seek out information and education. So I wouldn't underestimate a consumer-driven initiative, which I believe that telehealth really is. The basic issue being consumers want more convenience. Consumers want a more frictionless access to their physicians. So those two elements, I think, are something to take into account. And ultimately, to the extent you offer telehealth, I believe what you're really doing, even if it's not clear how it monetizes, you're offering a telehealth option that reduces the risk of patient churn. So to me, getting out in front of this is important in terms of a defensive position for your business. The next one is telehealth uses too many IT resources. Again, this is one of those objections that may have been valid 2 or 3 years ago, but if you look at the technology today, it's very much off-the-shelf technology. The difference is today it's embedded in the workflow for your specific application in your office, which makes it actually easier. But most, if not all, of this technology can be supported remotely in the cloud, you know, by your telehealth provider. So I do not see this as a legitimate reason not to adopt today. And then lastly, you know, you can or can't get telehealth from your EHR vendor. You know, EHR integrated telehealth offers a lot of benefits to managing your existing patients, and that's the real reason why you'd want to adopt it today. But if you look 2 years out, I think within 2 years, these same EHR systems will eventually interface with what I call appointment promoters. And as these two capabilities meet, what you'll begin to see are new patients that are becoming aware of available appointment inventory in their geography. So this in turn leads to an increase in new patients and as well in new patient referrals. So I think the important takeaway here is if you use the analogy of the travel industry, if you remember, you know, you have all these seats on the plane that need to be filled, and then evolved Expedia, which allows consumers to book those appointments. And I think what we're really seeing are the early innings of that same transition in healthcare, where eventually these appointments become visible to the consumer. These systems today will eventually integrate with those, what I call appointment promoters. So to me, this is a really important strategy that ultimately is a marketing strategy. So I spent a lot of time on that slide because I think it's a really important slide. I encourage you all to read the article from Healthcare IT News. Next slide. So to the extent that you are looking at bringing telehealth into your practice, I wanted to cover some very specific examples of where telehealth is actually working, which is a real thrust of today's webinar. So in a generic sense, if we're looking across all specialties, these are the obvious areas where you can start to deploy telehealth within your practice. First and foremost is conduct after hours premium services that include telehealth. So after your normal business hours or weekends, you can make that service available to your patients. Discussing lab results is something that I think most practices are already doing. They're calling patients for the most part. There's no reason you can't also tap into a video consult as necessary. Medication management is a very, very important and growing area just because of the complexity of managing your patient population around medication management. As you all probably are very familiar with, it's very difficult to keep track of the medications they're getting, and having a session where you can actually drill down with the patient on what medications they're on and managing those medications, and the staff, by the way, can do this as well, is a really important benefit that doesn't require necessarily an in-office visit. Conducting long-distance and rural visits, that's an obvious application. Triaging emergency and acute visits in lieu of urgent care. This is the urgent care solution. This is going to eventually kill the minute clinics of the world, I believe. In 10 years, I think we're going to see a significant reduction in the number of minute clinics, because this is a service that could be provided by most primary care providers. Lastly, but not leastly, telehealth provides a way for you to retain your existing patients, but also to increase your patient population if that's a goal you have ultimately. And I'll talk about how telehealth can actually dovetail into your marketing. But client acquisition is an important strategy for most practices, and telehealth is a really important way to do that. Next slide.
So I'm going to pause us here for just a second. We're going to do one more poll. I would like to, before we move forward into some of the specialty applications for telemedicine, get an idea for the likelihood of the practices and facilities who reported that they were not currently using a solution, to give us the idea of what's the likelihood that you believe your practice or facility may implement telehealth sometime in the next, let's say, 12 to 18 months. And again, we'll give this another minute for people to respond. We'll give this a few more seconds here. All right, I'm going to go ahead and close that poll, and we'll share those results. So for Greg and for Dr. Hawk, you can see that there's a pretty, I would say, widespread distribution here of people and their plans, obviously, for the, let's call it the next 12 to 18 months, assuming that half the people on the call are currently not utilizing a solution. Did anything here stand out in particular to you guys, or does this look fairly standard for an audience?
Well, I mean, I have more of a question. I'm really curious about the 20%, the 27, 27, 27 is probably an indication that there's still a lot of people sort of on the fence. They're looking at it, evaluating it, or trying to figure out can they monetize it. So that part, I think, is consistent. I'm not sure why people would not want to look at it. I do think it's disruptive technology. I do think that if you don't embrace it fully, eventually leads to a reduction in new patient population, but that may not be important for some of the folks on the phone who have thriving practices and are actually turning patients away. But I'd be curious to hear Dr. Hack's opinion on that.
Yeah, Greg, I had the exact same question, actually. My question to the audience really would be, what is the impediment or the barrier for the folks that are 20% not likely and also towards the lower end of the spectrum? What is really keeping them from exploring this natural avenue that medicine is kind of going towards?
I think one of the ways that we may be able to address that for anybody on the call who answered the, maybe, not sure, not likely, if you guys could privately send a question, via the question, if you could privately send potentially your reasoning for answering that way, I might be able to compile those very quickly, and then Greg and Dr. Hawk, I could offer that up to you guys towards the end during Q&A to review. All right, so while those are coming in, I'll go ahead and, I'm so sorry, I'll go ahead and I'll hand it back over to Greg to continue.
Thank you. So I'll go ahead and I'm going to highlight some of the specific use cases based on the practice specialty area, just to make sure we have some thought starters. And these are all very much aligned with actual use cases that are happening by specialty. Primary care, I think, is one of the areas in pediatrics where it's a fairly specific overlay that matches up to the first slide I showed on general specialties. So follow-up appointments, obviously, and with established patients. So just scheduling a follow-up visit after a consult with the patient who's been in the office is a very, very specific use case. That's getting quite a bit of attraction and traction in the market. Obviously, the weekend and on-call visits, then conducting ongoing counseling visits. So to the extent that you can use counseling time after hours or in between appointments, that's actually something that patients are seeing as very valuable. This next section, though, is really leaning into moving away from urgent care to managing either health or managing chronic disease. And I believe these two are where we're going to begin to see reimbursements moving significantly higher over the next 5 years. First and foremost, weight loss. Obviously that's a huge problem in the U.S. in particular. So I think we're going to begin to see reimbursements going up for weight loss, cholesterol, blood pressure, and smoking cessation monitoring over the next 5 years. So to the extent you can utilize telehealth surveillance and feedback from your patient on if they're actually achieving their care plan goals, those I think are going to be more and more reimbursable as we move forward. And then, of course, monitoring chronic disease, diabetes, hypertension, heart disease, the big three. Those, again, are also going to start to get, I think, increased reimbursements over time for surveillance, for remote surveillance. So it's not just a matter of seeing them in the office. It's going to become important that there's an ongoing strategy around how you motivate them, message them, and make sure that they're being compliant with their care plans. Next slide. The other thing it's very interesting to see is women's health and OBGYN is beginning to find very specific use cases. Obviously, family planning, preconception care can all be done remotely. And then post-operatively, C-sections can be actually viewed. So you can look at the patient, you can look at the scar, You can observe that remotely, which I think is very, very efficient for the patient as well as for the practice. And then, of course, monitoring high-risk pregnancies where the patient is going to have difficulty coming in for their consult. This could be a very interesting way to provide that service, and Azalea actually has a very interesting success case that they're going to talk about in the next slide.
We do, and we'll keep it as short as possible, but one of the scenarios that we thought was really interesting relative to the use of our telemedicine solution was one in which we had a patient who became pregnant but was unable to physically get to those outpatient visits for a number of reasons, but knew in her community of some of the telehealth capabilities that had been cropping up, and approached her OB wondering if it was possible to manage that at home via telemed throughout the pregnancy. And so the goal was that that patient would be able to receive all of their antenatal care via telemed for the duration of the pregnancy, and then only go in to deliver ultimately at the hospital. And so what ultimately resulted was that using the Azalea telemedicine solution, the patient was taught to use obviously the appropriate home equipment, had access to a laptop with a camera, a specific browser, and obviously a link to the Azalea patient portal. And during the course of those telemedicine visits, a backup OB would port into some of those visits prior to delivery to offer additional commentary. 2 home visits were completed during the course of the pregnancy, labs, and then first trimester, and an 18-week with the portable ultrasound for the midpoint ultrasound gender determinations. And ultimately what resulted was a fully planned delivery admittance and the delivery of a healthy baby girl. Start to finish, this patient was treated with telemedicine, and we just thought it was such sort of an interesting case that we thought we would share that as one example for women's telehealth.
So just to continue, I wanted to hit on some of the other specialty areas. What we're seeing now is surgeons are beginning to use telehealth to conduct their initial consultation. They're obviously interested in pre and post-op follow-up. So and then the wound triage. So similar to the C-section, they're actually observing the wounds. So we're seeing much more utilization by surgeons. Next. The other area, sort of a byproduct of having the capability within your practice, is that you can begin to utilize this for physician-to-physician communication. So whether that's PHI, that you're on a consult with a physician to talk about confidentially and HIPAA-compliant communication, this leads to obviously sending or receiving for referrals and just basic care coordination. And then the last one is just, as to the extent you can get on a call with a peer and review and annotate a diagnostic image, then this technology really lends itself to that. So the last slide is really, are there really benefits to your practice to implement telehealth? This speaks to the folks that are on the fence. This speaks to the folks that are in the no category. I just want to highlight the benefits real quickly. I think that the biggest benefit, in my view, is you're viewed as being innovative, and your brand is enhanced. It helps you build your practice. But I also think that, as a practical matter, I think you have to accept the notion that if you don't provide telehealth, then someone else is. What does that mean for your practice? If you're in the practice building mode, you're looking for retaining and keeping or building new patients, you want to reduce the risk of churn in your practice, and I think telehealth provides that benefit to your practice. Just to be able to promote the fact that you're doing telehealth sort of blunts the competitive threat. And then the next one is just increasing access for your patients. If you look at patient surveys, and if you believe that this is a patient-driven revolution, which I believe telehealth is, it addresses a core perceived need that the patients have expressed, which is they want to have frictionless access to their provider. And so what does that really mean? How do you do that in a world where you've already got a full schedule of brick and mortar appointments? Telehealth can actually begin to overcome that issue, and it creates a positive perception in your patient's mind. Obviously, earning additional revenue is important, as it always will be. The last one is the most important one, though, which is attracting new patients. And as I pointed out earlier, this is an important point. To the extent you adopt telehealth technology today, you're really putting yourself in a position to take advantage of an emerging ecosystem, which I think will come up. As the appointment promoters, I'll use that word, these are the Expedias of the world of health, begin to evolve. To the extent you have telehealth capabilities, you will be in a position to have essentially a catcher's mitt to receive these emerging new patient inquiries. So this becomes a key way for you to market your practice. So I think from a strategic standpoint, the folks listening on the call, to the extent you may be skeptical, I think you need to offset that with thinking through how this ecosystem will evolve. And I'm in an interesting position to see some of these appointment promoters are beginning to evolve, and the next step for them is to integrate with all the Azalea Healths of the world, so that that inventory can be visible to the consumer. So that is where I think all this is going to land within the next 3 to 5 years.
Guys, thank you so much for all of your insight during that portion of the presentation. I mean, genuinely invaluable and very much appreciated. What we wanted to shift to in the back half of the presentation was the idea that I think it's really important. I think we all believe that it's very important to actually hear this from, people who have actively used these types of solutions in their practice. And for that, I'd like to introduce again Dr. Rashid Haq, dermatologist here just outside of Charlotte, North Carolina, as well as the Chief Medical Officer with Gilead. Dr. Haq, I will turn it over to you.
Thanks, Allie, and thanks, Ray. So just a brief background. I've been practicing dermatology for about 10 years, and the vast majority is in the private sector with large multi-specialty groups, some in VA type of work as well, and then really have been more involved with the telehealth sector for a couple of years at this point. And this slide is kind of busy, but it really encapsulates a lot of the practicalities that we have seen on our end as physicians. Efficiency is always a prime concern, and obviously a lot of these things will speak to that as well. And so practicalities, as far as the initial things, market multiplier. Telehealth is unique in that it's not geographically limited, which really improves reach. One can expand their practice and reach out to populations that otherwise would not be available to that practice. Efficient allocation of resources is another factor here. We're seeing this with a lot of different sectors, but especially in healthcare now with staff and provider time, in this case not being limited to just seeing patients at any one location, but rather one can then utilize provider time and supply efficiently across multiple venues. So those are really key factors, even from a business standpoint. Some of the challenges, and there are many challenges, but they're also generally easily surmountable with the right technology and the right mindset. But when running a geographically dissociated space, which telehealth kind of builds, and it just really depends on the practice, but for larger practices, this will add to that. There's a coordination factor with local and regional resources such as pharmacies, labs, imaging, and really moving data effectively. And this is something that an integrated EHR can really help with, especially when it understands the telehealth sector. Another area, time zones. This may not be as much of an issue for smaller practices, but when you really get into a larger telehealth provider, you have disparate time zones for patients, also for providers, that kind of thing. So you really need a solution that can address this fluidly. And then tech adoption. The biggest issue that I have seen is really just user error, the human element when it comes to tech. Good training really helps, but the other things are really having an intuitive platform and having an integrated workflow. And in this case, having the telehealth integrated into the EHR space or platform, I think really makes everything fluid rather than having to go through 2 or 3 different resources. So moving on to the benefits, a lot of these are kind of obvious and build on each other, but a timely provision of care, being accessible immediately or in the near future, and without being constrained by transportation issues. This really helps as far as getting patients in and also building a positive rapport with patients. Access to care, which is kind of part of this, especially when dealing with rural or distant populations. They don't have to actually physically come in for some of the issues that can be dealt with easily with telehealth. And as Greg kind of pointed out, there are a lot of advances in terms of physical examination over the telehealth portal and modality. So really a lot can be done over that module. Patient retention. Being available to patients when they need to be seen really helps to retain the patient and also to improve patient satisfaction, which is really critical. CCM strategy, this telehealth can be built into a comprehensive chronic care management strategy, which allows billing for those particular codes. And it's just another form of communication which can be effective for certain populations where simply a letter or a phone call may not suffice. And then connecting with patients on a different level. Telehealth, especially live video conferencing, has a personal touch that's, for certain sensitive issues, that kind of thing. It really steps beyond a simple phone call again. Expectations as a standard, especially with getting involved with the younger generations or the tech-savvy generations. It's really an expectation that a business or a platform has a web/app/telehealth or teleservice capability. It really is expected at this point, and not having that really puts someone behind the curve. And finally, the keys to success, I think personally, one is having partners that are committed to telehealth. It is a rapidly evolving field. You do want vertical integration and tech support, as well as revenue cycle management that really understand the unique challenges with respect to telehealth. So thank you. That's what I have.
Of course. Dr. Hawk, I'm curious for you, if I could just ask your personal experience, what has been the biggest benefits for you, or what were some of the, the challenges that you personally faced, or the things that you recognize being an actual user of telehealth in your practice, or maybe impact on your patients?
I really feel like in healthcare in general, there's a lot of siloing of data, a lot of different platforms and products, and trying to integrate all of that into one platform really helps in terms of moving data from one place to another and the crosstalk. So I think that's really where the advantage shines in terms of what we're doing with telehealth at this point with you guys.
Good, great. Well, thank you so much for your insight there.
Sure.
We just have a couple quick things to go through. So I wanted to touch on a couple of sort of the features and benefits that you heard both Greg and Dr. Hawk mention relative to their experience and their interaction with telehealth. I won't spend very long on this at all, but we're happy to schedule one-on-one time with anybody who would be interested in getting a demonstration of the Azalea telehealth solution. You can see a couple of those features and screenshots here, but we are happy to schedule time to review the product with you. Again, you heard the importance of the ability to record that session, save it directly back to a health record, the personal touch of being able to live stream that call and still have that face-to-face interaction with the patient. And uniquely for Azalea, we are one of the first, actually, EHR companies where our telehealth solution is both proprietary and fully integrated into our EHR patient portal and our mobile apps and billing functionalities. So we will send this presentation out. By all means, please feel free to reach out to us to request a demonstration. We can walk through not just the telehealth solution, but also our RCM telehealth capabilities. You heard Dr. Hawk talk about the importance of somebody who understands not just the use of the solution, but how to maximize the billing functionality and the reimbursement capabilities. Or we can also help you learn more about getting connected to available grants and assistance for telehealth implementation, because there are opportunities out there. We have a lot of great connections that we can help put you in touch with to learn more about that. And we will now spend a little bit of time answering some questions. If anybody has questions, please use, again, the question section found in the lower right-hand side of your webinar panel to submit those for either Greg or Dr. Hawk, and I can go ahead and communicate those back to them. While those questions are coming in, Greg and Dr. Hawk, wanted to let you know that I did receive a few responses back from attendees with regard to answering not likely or not interested. So the first one I got says that from a discussion at the HFMA meeting in January, it appeared that there would be very little revenue potentially generated from telehealth. And the second response that I received said that part of the reason for non-interest for this practice is that their malpractice carrier does not cover telehealth services for patients outside of their state, and based on where they're located, they have a lot of patients in a tri-state area. So they have a lot of patients who would potentially end up, obviously, not covered under the malpractice carrier. Any thoughts on either of those?
Yeah, I'll go first. I mean, I'm not going to speak to the second one. I do know that malpractice providers generally are trying to figure out how to provide malpractice on a per call, per consult basis as an add-on, and I think that's probably the reason some of them are hesitant, besides the fact that there's still this belief that you have to physically see the patient in the office. So those use cases where you feel like you need to see the patient, then I feel like you need to suggest that you need to see the patient. So I mean, that's the malpractice piece. You know, and the first question is more, you know, the strategy that I think you have to look at is not just your ability to monetize it. This is disruptive. And again, I've been part of several disruptive technologies over the last 20 years, and I think you want to be Netflix, not Blockbuster, and you want to anticipate the impact of attrition or churn in your business to the extent you decide, you know, you don't want to adopt it. I think the patient has a voice. The patient wants a frictionless way to access their provider. I do think there's incremental availability that you can make money on, and I do at the same time. I mean, there were 200 bills in 2007 or 16 states, all designed for one single purpose, which is to eliminate the potential for non-reimbursement. Those will take time to work themselves through each of the states, but I think everyone understands that ultimately efficiency matters, and one of our biggest cost centers in healthcare is poor efficiency. So I think we can look forward to seeing this become less and less of an issue, and then I would say you need to be early, not late, in terms of adoption, just because your ability to integrate this into your practice will then lead to your ability to monetize this efficiently later.
I agree with everything Greg said, and really looking at the first question, the revenue, there's, you know, direct revenue from telehealth, which may be fractional initially, and part of that is just adoption. I think that over the next several years we're going to see a lot more adoption of telehealth across the populace. But more importantly, and kind of as Greg touched on, there's ancillary revenue or benefits to really think about as we move forward. You know, if other practices are offering telehealth and a given practice is not, that's going to drive some of the decision factors for patients and families in terms of deciding which group to stay with, which group to change to, that kind of thing. So it really translates into patient retention. It also translates into branding and business positioning, meaning if the business 5 years from now does not have telehealth, it's really going to be an outlier, I believe, rather than the norm at that point. The second area, the malpractice, you know, in my opinion, I think the area is rapidly evolving, and there may be some companies, including certain malpractice carriers, that may just be dragging their feet at this point, and that'll change. I don't perceive that to be an issue as we move forward with telehealth.
Thank you guys for addressing those ones. I have another one here. One of our listeners asked if practicing state to state, and Ria, this may actually be an excellent question for you. I know you're well versed on the reimbursement side. If practicing state to state is credentialing and contracting a problem, and how is it solved? And also, where do we go to find codes for billing?
Hey everyone, yeah, I can answer that question. So it does differ state to state. There are going to be different rules regarding credentialing and then dealing with the actual contracts and the insurance companies themselves. So you would have to reach out to whoever you are working with your current contracts and see what kind of rules there are for telehealth and reimbursement within that state. As far as credentialing goes, there hasn't been a lot of resistance. So if you already are credentialed, with a payer for your location, it's a pretty simple process, and usually there aren't any additional steps that you need to take. And as for the codes for the billing, again, you would have to just reach out to whoever you are working with your payers to see in which codes are they actually accepting and how to actually go about billing for it.
Excuse me, and I've got another question here. Wanting to know if using telehealth can help a practice with their MACRA and MIPS scores for this year.
Can you repeat that? I didn't. You got garbled right as you said.
I apologize. I have a question here asking if utilizing telehealth at the practice level can help with MACRA and MIPS scores for this year.
This is Ria.
I'm going to have
as well.
Yes, Ria. That one is beyond my pay grade.
So definitely, there's definitely a really good application for telehealth if you are participating in MACRA and MIPS, specifically if we look at the clinical practice improvement category. So if you are using telehealth in your practice, you would get additional points to help you receive a higher score.
Yeah, and I believe it's the clinical practice improvement activities, Ria, that you mentioned, is where telemedicine and remote patient monitoring fall underneath that.
Exactly.
And I've got another question here from a listener who would like for us to talk a little bit more about telehealth for chronic care management, wanting to know, is it well adopted at this point? Is it successful?
Let me take that one first. Everyone, I think, to a person believes that the real killer app for telehealth is chronic disease management. If you look at Medicare reimbursement starting in 2016 or 15, actually, they began reimbursing for remote monitoring of patients that had 2 or more chronic diseases. And I think the reason that they stepped up to the plate first is they understood clearly that to the extent that we can start to surveil patients with 2 or more chronic diseases, we can eliminate them or prevent them from having to enter into a much more expensive treatment regimen later in either the hospital or other. So that's not a huge profit center for most primary care practices. That I think last time I read, they were reimbursing about $45 a month for 20 minutes of remote surveillance. But I think it leans into the notion that we're going to begin to see reimbursement programs that are specifically designed to prevent these chronic conditions from progressing. And so where does that lead? I don't know, but I think we're seeing right now that is probably where most providers will begin to see significant abilities to monetize telehealth as compared to urgent care. And just to put that in context, urgent care is a one-and-done event. It generally reimburses about $50 to $60 per episode. and that compares to a chronic disease management patient who potentially could yield about $50 to $60 per month for remote monitoring of up to 20 minutes if we're looking at Medicare as the comp. So what I would do if I were a practice is I would be watching closely to see how Medicare begins to either increase or decrease reimbursements for chronic disease management, and look to see if you have Medicare patients that match that criteria for that. But generally speaking, to the extent Medicare goes, so goes the payers. And so I suspect that they will follow suit very, very soon to come up with similar programs. The ounce of prevention is worth a pound of cure has never been more true in telehealth.
I basically agree with what Greg said, and I think that CCM is a growing area, and it's a natural reimbursement that can be captured with proper documentation. Again, 20 minutes a month for the right patients that have 2 or more chronic diseases and so on and so forth, and have been consented for CCM. A lot of times, practices are already spending those 20 minutes a month doing medication reviews, management of care, that kind of thing. It doesn't even have to be the provider. So it's just a matter of capturing that and then submitting the billing code for that. And then, if I understand correctly, there are also billing codes for 60 minutes and 80 minutes that are reimbursed even better for those patients that would qualify for that. And telehealth is just another tool in really the toolbox for that.
Let me make sure I underscore. Remote surveillance qualifies as the 20 minutes or the 80 minutes or the 60 minutes.
I believe that's correct, yeah.
Yes.
And I have a follow-up question to go with that. Somebody asked, and Rhea, you may be able to step in on some of this as well, any success with going about getting local payers to include telehealth in their benefits? Have you guys seen any documented cases of that?
Yeah, we've been working with insurance companies pretty heavily the last couple of months, and surprisingly, a lot of the state Medicaids, they're actually very, very interested in having their providers start using telehealth. I think the benefits are really starting to kind of surface, and even the insurance companies are starting to pick up on that. So there are a lot of situations where a lot of state Medicaid programs and federal grants are available to kind of help you guys get telemedicine and the technology needed actually in the system at very low cost or hopefully little cost to you. It just kind of takes reaching out to the contract who you're working with, and then kind of talking to them and making sure that they know that you really want to push for telehealth in your practice, and they're more than willing to help.
Excellent. Thank you guys all for the feedback there. If we don't have, let me see if I've got any more questions here. I think we are good if we don't have any more questions. Please feel free, if you have a question that we did not get to, please feel free to follow up with us again after the webinar requesting some time one-on-one. We are happy to help in any way that we can. And on behalf, again, of the Azalea team, I just sincerely wanted to thank everybody for attending and participating in today's webinar. A huge thank you to both Greg and Dr. Hawk for being with us today to share their insights and experience around telemedicine, and to give all of us a few key items to think about as we consider our own strategies looking ahead. Greg and Dr. Hawk, again, thank you. To remind everybody one more time, the webinar recording, the presentation slides, and all handouts will be emailed to attendees. If you guys have any questions, would like to follow up one-on-one, please feel free to email us at info@azaleahealth.com. We are happy to help, and we hope that you guys will join us again in the future for industry webinars. Thank you all very much, and have a wonderful afternoon.
Thank you.
Thank you.